due to the sustained limited and unstable vaccine supply, only 42 partners are able to receive allotments. Even with that and those challenges around vaccine supply, we are pleased with our county's progress. As of today, as Chairman Cronin mentioned, DuPage County leads all metropolitan Chicago counties with 2.88%, or over 28,000 persons of the population fully vaccinated with 2 doses. In addition, we have more than 100,000 individuals, 100,915, and yes, we are counting every single one, to have doses administered to our county residents. Again, we are pleased with this, pleased but not at all satisfied. Currently, we are receiving between 10 to 14,000 doses of vaccine per week, which means we can only administer that number of doses per week. We are fortunate to have a robust network of healthcare providers in DuPage County who are committed to administering vaccine as soon as it is available. And when doses do arrive to DuPage County, they do not sit in freezers for extended periods of time. Instead, appointments are opened, links to schedule an appointment are sent, and doses are administered into the arms of those in the eligible groups. Vaccinations for both phase 1A and 1B priority groups continue at a steady pace. However, the limited vaccine supply is hindering everyone's ability to vaccinate large groups. But we know over the next and few coming months, the vaccine supply will increase. And that's when we're confident that the network of providers that we have built in the county will get this life-saving vaccine administered into arms of DuPage County residents as quickly and efficiently as possible. Now, as a reminder, the health department has been operating a community vaccination clinic since the 3rd week of December. We actually opened our clinic the week of the Christmas holiday. This centralized clinic, offered at our main location right across the field, has focused on providing vaccines to non-affiliated healthcare personnel in phase 1A. Recently, we're pleased to announce that our clinic surpassed 10,000 doses administered, and we continue working through the thousands of remaining healthcare personnel on our registration list. But as has been said before, we must do more. And so we identified the DuPage County Fairgrounds as a preferred location for our expansion due to its central location, easy access, as well as the safety it provides our staff, volunteers, and the residents being vaccinated. We have sincerely appreciated the support of the fairgrounds staff, led by Jim McGuire, and are grateful for their partnership and look forward to this continued relationship. Currently, our efforts at our clinic have topped out at vaccinating up to 2,000 eligible persons per week, or roughly 400 individuals per day. By moving the health department's COVID vaccination clinic to the fairgrounds, we will have the potential to administer up to 1,000 vaccine doses per day, or 5,000 doses per week. These outcomes, however, are only projections until we have a vaccine supply to make them a reality. I want to reinforce and emphasize that this clinic will be open by appointment only to ensure the safety of everyone coming to the clinic and to ensure that we have an adequate supply. Appointments must be scheduled in advance, and no walk-in or unscheduled appointments will be accepted. While waiting for a vaccination appointment, we also encourage anyone to visit our website for updates. Due to the challenges with vaccine, we're also encouraging our residents to register through other providers, including pharmacies, healthcare providers, or medical groups. and to take advantage of the vaccine at the first available opportunity. Finally, I'm pleased to announce the Health Department has expanded our call center to support residents with vaccine registration and to answer any COVID vaccine-related questions. Residents who may not have access to the internet, a computer, or need support with registering, including language assistance, should call 630-682-7400, and a representative will assist them. Without a doubt, we will get through this pandemic. And we are convinced that the best way to get through this is through partnership, support, common goal. We have appreciated the support of our county board chairman, the entire county board, our Board of Health, DuPage County mayors, our state legislators, and our federal elected delegation. Today, I am so very pleased that several members of that federal delegation are able to join us and provide us some comments. It is my pleasure to welcome all three, the U.S. Congressman Sean Casten, representing the 6th District, Congresswoman Lauren Underwood, representing the 14th District, and Congressman Bill Foster, representing the 11th District. Thank you again for being here today. We appreciate your support, and I'd now like to invite Congressman Casten.
Thank you. Thank you so much, Karen. Thanks to all who are here. Thank you, Chairman Cronin. We are extremely fortunate in DuPage County. You've heard it a number of times that we have the highest vaccination rate of any of the counties in the Chicago region. One of the top rates. You'll tell me where we are statewide. I know we've been consistently one of the top rates statewide. And I agree with Chairman Cronin. We're nowhere near where we need to be, but we can take pride in the competence of your team, Karen, and the infrastructure we've put together here relative to the other states or the other counties in the region. My height and my vertical jumping ability means I'm never going to dunk a basketball. My height and my vertical leap means I'm never going to dunk a basketball. And I've long since resigned myself that I got to play the cards I'm dealt. We need to be honest about the cards we've been dealt in this moment. There are way more people who have this vaccine, this virus, than anybody wants right now. There are way too many people who have died. We got to this point because we did not have a coherent national response to this virus. We made states compete first for PPE, then we made them compete for testing, and we've made them compete for vaccines. It shouldn't be that way. Fortunately, we're starting to move forward on that right now, but there is not a person out there at any level of our public health structure who is happy about the number of people who are infected. And there isn't a city, there isn't a county, there isn't a state who doesn't want more vaccines right now. And so my hat is off to everybody in the public health department for being exceptional, for working under extremely trying circumstances. I would ask everybody who is feeling frustrated, own that. You should be frustrated. But please be patient with the folks who are working ridiculous hours and sacrificing to make sure that we can be vaccinated in this moment. Because ultimately, our measure of success is not going to come because we've got the best vaccination rate of any county in the country. Our measure of success is going to come because the virus isn't spreading. The virus doesn't know where county lines are, where state lines are, where city lines are. And we have to make sure that we trust our public health officials to make the most of a system that ain't perfect. But it's the system we have, and when we are through this, let's hope that we can all work together to redouble our commitment to building a more robust and equitable public health system. Thank you, and it's now my pleasure to introduce my colleague, my friend, and legit public health expert, Lauren Underwood.
Well, thank you, Congressman Casten. I'm Lauren Underwood. I have the honor of representing the 14th Congressional District, and I'm truly very excited to be here at the DuPage County Health Department's Community Vaccination Clinic. Thanks to the tireless work of countless scientists and public health professionals, including those right here at the DuPage County Health Department, we are finally gaining the upper hand in the battle against COVID-19. But we know we have a long way to go before everyone who wants a vaccine can get one. Web-based appointment signups are filling up faster than people can register, and local health departments are overwhelmed with phone calls from people wondering where to go for a vaccine. This process, it's been difficult. And the bottom line is that our current vaccination process needs to be further scaled up as more vaccine supply becomes available. To address these challenges and carry out an efficient COVID-19 vaccine campaign that prioritizes the people who need it most, Congress needs to act swiftly and boldly. The next relief bill must include significant funding to accelerate vaccine administration, with a particular focus on providing vaccine doses and outreach to ensure that nobody is left behind. We also need to fund the workforce that will carry out the vaccination efforts, as well as the testing, contact tracing, and other critical initiatives to control the spread of the virus. I've introduced two bills, the Community Immunity During COVID-19 Act and the Health Force, Resilience Force, and Jobs to Fight COVID-19 Act, to make the investments that will be needed to end the pandemic, prevent the next public health crisis, and ensure a robust economic recovery. This pandemic has shown us that when we come together, we're capable of anything. The expanded community vaccination clinic here in DuPage County represents a tangible step toward beating COVID-19. I remain committed to ensuring that our community has the federal resources it needs to vaccinate efficiently and equitably and help our economy build back stronger than ever. Thank you so much, and it's my honor to now welcome my colleague from the Illinois 11th District, Congressman Bill Foster.
Well, thank you all. I'm Bill Foster. I represent the 11th District, which has a total of 5 counties in it, and it has the second, third, and fourth largest cities of Illinois in the form of Aurora, Joliet, and Naperville. And I can assure you, if it's any consolation, that there is not one county in my district that thinks it's getting enough vaccine. That's the reality. We've understood the basic numbers across our country. And we have a lot of capability. In a normal year, just the flu vaccine, we vaccinate 3 million people a day using the network that we do, which is very diverse, but that's a big number. And in Washington, when we saw this crisis coming in the early spring, and we saw the scientific promise of the early results on vaccines, we voted a bunch of money and gave a bunch of explicit instructions to put that money in every competent vaccine manufacturer. And not all of them have crossed the finish line first. The 2 that have, Moderna and the Pfizer-BioNTech, are delivering vaccines over 1 million doses per day, ramping up towards 2 million doses per day nationwide. And that's the battle that we had to win. There's some other good news. It looks like by the end of this month, we have a good chance of getting a third vaccine that won't require the gymnastics or the refrigeration here. And there may be additional vaccines on a time scale that will really help with the overall national goal of getting everyone who wants a vaccine to have a vaccine by the end of June. And I think it's going to be a stretch, but I think that is our national goal, and I think we can achieve it. Partly because of the strength that we have in the last mile with, groups like this. And everyone that you don't see here because they're all of the other providers. I mean, what was the number of providers that you had? 96. That is the diversity and the strength of the last mile in this country, and we see it everywhere. It's in every county that I represent, and I want to thank you all for just gritting your teeth, putting up with the shortage that everyone knew was coming, and doing your best to make the distribution equitable and as fast as we can possibly make it. So, and now I guess I will turn it back over for any questions. Yeah. Okay. Thank you.
So that concludes our prepared remarks. I think we have some time for questions. I can. So thank you, Janice, for always pushing us to be a little bit better. I think your comments are right on. The idea of wasting vaccine is abhorrent at this point. So we don't want to waste vaccine. However, what we have done at our clinic is developed a backup list exactly as you're describing. It's not a random run to the next office and see who's there to bring them in. Instead, it's an intentional queuing of individuals who are eligible and on our list to be ready to come in at essentially a moment's notice for their vaccine. Now, is it perfect and is it county-wide yet? No. However, it feels like we've been doing this forever, but really with our 1B population, which includes the 65 and over and some of the more vulnerable residents, we've been at this is the beginning of week 3. So we're very early in this process, and we are absolutely committed to making sure that any community vaccine site provides that same level of support. Mm-hmm. So if you have internet access, please go to our webpage, www.covid9, no, www.dupagehealth.org/COVID-19 vaccine. On that web page, you will see a link, a tile, if you will, for vaccine registration. You click that and you register. That does not mean that you are scheduling an appointment for the vaccine, but rather that you are registering for the opportunity to schedule that appointment. While we're working our way down our list, which we do on a chronological basis as people have gotten registered and they're eligible, we'll continue to send those individuals weekly updates to reassure them that they are still on the list, because that's sometimes a concern. Well, I registered, but I haven't heard back, and it's been 3 days. What do I do? So we're sending out weekly updates to those individuals. Then when we get vaccine in and we're ready to schedule clinics, then we send out the link for that person. Now, that link is meant for that person because that person is eligible. And we ask people not to share that link, but they do. And what happens then is that other people on the list who are eligible and have done what they need to do to get registered don't get that opportunity. And so we would ask people to comply with the idea that this is your link and your link alone. Now, if you don't have access to the internet, then you can call, if you're in DuPage, you can call 630-682-7400, and we will have somebody answer the phone and walk you through that same process. So those are the two primary ways. Yeah, vaccinations will start here tomorrow. They've been ongoing across the campus since the third week of December. It closed down today at noon, and they will reopen tomorrow morning here. 8, yes. About 1,000. Sure, yes, they'll receive a call. And then they'll get scheduled based upon that call. Well, we currently, that's essentially what the 96 partners that we have would be absolutely willing to do and happy to do, is provide those vaccines. Any insight? From a manufacturing standpoint, what we hear is that probably it won't be till March till the vaccine supply improves. And again, as Congressman Foster indicated, not only will the existing supply of Pfizer and Moderna be accelerated, but we may also have another vaccine available in our arsenal. Mm-hmm. Okay. Thank you.